The following areas are under level 3 from January 9 to 15, 2022. And it's Batangas, Bataan, Cagayan, Pampanga, Zambales. Those are the provinces. Now the cities is Angeles City, Baguio City, Dagupan City, Iloilo City, Lapu-Lapu City, Lucena City, Naga City, Olongapo, and Santiago cities.
We have to really do a much better job in managing the health situation, which is we are trying to do. Getting the vaccines to the unvaccinated, getting the unvaccinated convinced to take the vaccine. It's not only about making money, it's about ensuring that the lives of our people are protected. What we believe is opening up the economy will definitely save a lot of livelihoods and lives.
If we continue to ramp up the vaccination of our people and with the gradual resumption of our economic activities, then we can hope for better days. Again, I would like to ask everyone to go out and get yourself vaccinated. This is part of your civic duty to protect others.
Let's make 2022 a much better year for all of us. Let's vax to the max.
Susunod na programa ay rated PG. Ito ay nangangailangan ng patnubay at gabay ng magulang para sa mga batang manonood.
Magandang umaga Luzon, Visayas at Mindanao. Magandang umaga rin po sa lahat ng mga Pilipino saan man panig ng mundo. Sa gitna po ng patuloy na banta ng Omicron variant, binabantayan rin ng buong mundo ang iba pang bagong variants na sinasabing mas nakakahawa at posibleng mas delikado kaysa Omicron. Alamin din natin ang patuloy na ginagawa ng pamahalaan para labanan at paghandaan po yan. Ako po si Yusa Crack Ignacio. Simulan na natin ang public briefing hashtag #LagingHandaPH. Umabot na sa mahigit 90 milyon na bakuna kontra COVID-19 ang available sa bansa sa kasalukuyan. Kaya naman patuloy ang paghikayat ni Senator Christopher Bongo na tayo ay magpabakuna at magpa-booster shot. Narito ang detalye.
Mahigit sa 90 milyon na bakuna ang available ngayon sa bansa. Sa mahigit 213 milyon nang naideliver sa Pilipinas mula Pebrero ng 2021 hanggang kahapon, 114.2 milyon na dito ang naiturok hanggang nitong Enero at Gis. Sa gitna ng mabilis na hawahan ng COVID-19, muling nagpaalala si Senate Committee on Health Chairperson Christopher Bongo sa mga Pilipino na kwalipikado na magpabakuna o magpa-booster shot na. Ang mga hindi kasi bakunado kapag kinapitan ng COVID-19, nagiging malala ang sintomas nila na maaring ikamatay, ikumpara sa bakunado na mild symptoms lang ang nararanasan. Ang pagpapabakuna ay isang pagmamalasakit din anya sa medical frontliners ng bansa dahil naiiwasang maospital ang mga bakunadong nagkaka-COVID. Target ng pamahalaan ang 77 million na fully vaccinated na Filipino at makumpleto ang pagbakuna sa mga kabataang edad 12 hanggang 17 hanggang sa katapusan ng Marso. Habang hanggang 90 million na fully vaccinated pagsapit ng Hulyo hanggang Oktubre at 72.6 million ang nakapagpa-booster shot. Ngayon ay target na mabakunahan ang nasa 3 million na senior citizen at 25 million na mga kwalipikado na kasama ang mga menor de edad. Inaasahan na rin ang pag-i-issue ng emergency use authorization para sa iba pang brand ng bakuna bukod sa Pfizer at Moderna bilang ligtas na bakuna para sa mga bata. Hanggang nitong Lunes, 52.8 million na ang fully vaccinated, kung saan 3.6 million na rito ang nakapagpa-booster shot. Mayroon namang 57.8 million nang nabigyan ng first dose ng COVID-19 vaccine. Tinitiyak na 24/7 na operational ang 310 na mga RT-PCR laboratories sa bansa, bunsod na rin ng pagdami ng mga isinasailalim sa swab test. Pinatitiyak rin sa Interagency Task Force on Emerging Infectious Diseases at sa Department of the Interior and Local Government na available ang mga Emergency Operations Center ng mga lokal na pamahalaan. Panawagan ni Senator Go manatiling alerto at sumunod sa health protocol upang mapagtagumpayan anumang pagsubok ang nararanasan ngayon ng bansa.
Binigyan diin ng Malacanang na may magagawa ang taong bayan para mapigilan na mabilis na hawahan ng COVID-19 at ito ay ang pagbabakuna. Ayon kay Acting Presidential Spokesperson Carlo Nograles, kahit may banta ng Omicron variant, nananatili pa rin epektibong panlaban dito ang COVID-19 vaccines. At kahit marami mga tinatamaan ng sakit ngayon, lumalabas sa mga datos na malaking porsyento rito ay mild o asymptomatic cases lamang na bunsod ng malawakang pagbabakuna sa bansa. Sa ngayon, higit 114 million doses ng COVID-19 vaccines na ang kabuang bilang na naiturok sa bansa, kasama na ang booster shot. Bukod po sa Omicron variant, binabantayan rin ang tinaguriang IHU variant na mismong si Pangulong Duterte na ang nagsabi na posible rin pumasok sa bansa whether we like it or not. Bukod dyan ay may mga kaso na rin umano ng pinaghalong Delta at Omicron variant sa ibang bansa. Yan at iba pang usapin ang ating alamin mula kay World Health Organization Representative to the Philippines, Dr. Rabi Abingasinge. Good morning po and welcome back to the public briefing, Dr. Rabi.
Good morning, Yusek Raki. Happy to be here. Happy New Year.
Happy New Year po. Following the result of the Philippine Genome Center's latest sampling wherein 60% is Omicron, should we assume that Omicron is now the dominant variant in the country, Dr. Rabi?
Thank you, Yusek Raki. It's an important question. We have been trying to understand the spread of Omicron in the Philippines. And it is not surprising because the transmissibility of Omicron is significantly higher than the currently predominant Delta variant. And so we would expect to see Omicron displacing the Delta variant. Now, the problem is that we have seen a very small number of sequencing reports over the last month in December. And the last batch of samples were largely from NCR and from returning overseas Filipinos who tested positive. And so it's not surprising that among the ROFs and also in NCR that we are seeing now Delta variant being displaced by the Omicron variant. To say whether it is the predominant variant in the country, it will soon be so, but because we have very few sequencing results from the other regions, it's difficult to conclusively judge. But it's not entirely a surprising result, and we believe that in the near future, Omicron will displace Delta variant as the predominant variant, as it has done in several other countries.
But Dr. Rabi, what can you say about mass testing versus targeted testings? Do you agree that targeted and risk-based testing is still the best strategy to do in spite of the exponential growth in cases?
So the evidence points to Omicron having a 3 to 4 times higher transmissibility than Delta variant. And a lot of those infections are mild or asymptomatic, as you mentioned in your report in the country also now. What is important is that we know that Omicron variant is accompanied by an exponential increase in transmission, especially when minimum public health standards are not adhered to. And so what we are seeing now in NCR and adjoining regions is this kind of exponential increase that we have seen in several other countries. And in those circumstances, given the higher transmissibility of Omicron, it would be prudent to reserve the testing capacity to test symptomatic people, especially symptomatic elderly and vulnerable people. On the other hand, it's also not very useful in testing other asymptomatic people in a household once you have confirmed Omicron cases in a household because of the higher transmissibility. They are very likely to get infected or would have got already infected. So, by testing such people who are asymptomatic and close contacts of positives, we are artificially driving up the positivity rate. It would be far better to use the positivity, the testing capacity to understand where is the transmission and use that to suppress further transmission. So I think targeted testing is a better use of the resources spent on RT-PCR tests. And the hypothesis that if you have a confirmed case in a household and other people are symptomatic, there is no need to confirm testing, just need to assume that it's Omicron. And because it's much milder, it would be prudent to just isolate or quarantine, as the case may be, for the required number of days. It would be not necessary to test and confirm every infection, unless, of course, you are in the vulnerable groups or elderly, where it would be useful to understand so that we can initiate early treatment. Most other people don't need specific treatment. Thank you.
Dr. Dr. Ravi, can we say that we are now at the height of the surge, or should we expect the trend to increase further? Until when is the surge projected to continue, Dr. Ravi?
It's very difficult to say. We are seeing that the incubation period in Omicron is lower than with the Delta and with the wild type. And so the disease progresses much faster and develops much faster. Of course, we now know that the National Capital Region and some adjoining regions have been put under alert level 3 from the 3rd of January, I believe, or subsequent dates, and that is showing a very significant reduction in mobility. It's also showing, if you look at the streets of Manila, many people are not going out, they are not taking the risk. So this is going to have a significant impact on transmission. And if you notice, yesterday we saw a 5,000 case decline in comparison to the previous day. So this may be an early indication that we are seeing a plateauing, but we need to be aware that we will continue to see total numbers of cases increasing as the virus spreads out into other regions like region 3, 4A, and even region 5, Visayas and Mindanao. So this is inevitably going to happen, but we need to be careful in assessing and jumping to conclusions. What is critically important is we reduce the opportunity for virus transmission by following the minimum public health standards, by reducing close contacts, by early isolation and quarantining if you know that you are having symptoms and you have been a close contact, so that we minimize the opportunities for virus to spread. And this way we will be able to reduce the transmission. So it's now premature to say that we've reached the peak. We may still see an increasing number. We are carefully looking at how it's evolving in NCR and in the other regions. And at this point of time, it's too premature to assume that we have reached the peak.
Dr. Ravi, why do you think it's dangerous to think that Omicron may be the path to herd immunity?
Well, we have seen this virus evolving, and we've seen with Omicron that people who have had previous infections with the wild type or Delta variant are having second and third infections. So the whole concept of herd immunity assumes that if you have got immunity, you will no longer get the infection. But with coronaviruses, because they are mutating rapidly, the immunity you develop to a variant doesn't afford full protection. And so the concept of herd immunity, I think we should not talk about it. What is more important is that we assume that everybody is at risk and try to protect them as much as possible through ensuring that our systems are ready, the PPI-TER, but of course, more than that, the vaccination and the compliance with the minimum public health standards.
Dr. Rabi, what is the WHO's, can we get the WHO's reaction on Pfizer's Omicron specific vaccine, which is targeted to be released around March? Will that still be timely to manage the spread of the variant?
If you're talking about manage the spread of the variant in countries that are already seeing a surge, it may be too late. The issue is that the already existing vaccines, all WHO UL listed vaccines, are capable of preventing severe disease and death. So the new type of vaccine, what we are looking for is a vaccine that can prevent people from getting infected with mild symptoms. We're not quite sure whether Omicron-specific vaccine will be useful for new future variants. So it may be useful to prevent infection in people who are still at risk of getting Omicron, but if it's only going to be released in May, it may be too late for countries like the Philippines and other countries that are seeing a surge now.
Dr. Rabi, what information does the WHO have so far about Delta Cron? Are you in coordination with the Cyprus government already with regards to the reported 25 cases of Delta Cron?
It's very early days with Delta Cron. We've just heard about it. We are trying to understand it. There's some speculation that there may be some laboratory contamination. Teams from headquarters are undoubtedly engaging with the authorities in Cyprus to better understand. So once we have a clearer understanding, we will comment on Delta Cron.
But apart from the Delta Cron, is the IHU variant, which is said to be more transmissible than Omicron. Do you agree that, like any other variants, IHU will inevitably enter the country whether we like it or not, Dr. Rabi?
So IHU variant is a little different. It has been circulating since September or November last year. Originally, it's believed to have evolved in Cameroon in Africa, but detected in France by the IHU Institute. This variant has not shown a capacity to predominate in transmission, so it doesn't seem to have the capacity to be displacing Delta or Omicron. We are still looking at it. It has been classified as a variant of under monitoring. And WHO, together with the authorities in France and other countries where this variant has been detected, is monitoring the situation closely. But I don't think it is at this point of time warrants to be classified as a variant of concern.
But Dr. Rabi, should we now be worried? And what are the preparations we must be doing before this variants enter the country while managing the Omicron spread?
So we are now into beyond the second year of this pandemic, and we have been developing strength capacities in the country to manage this kind of situation. And it's important for us to now take a very risk-based approach, not only in preparing for future variants, but also in how we respond to currently circulating variants. Because that was why we had those initial lockdowns and ECQs and all of that to build the system's capacity. Now we need to see how we protect the economy and how we minimize the disruption while protecting the health and the lives of people. So this has to be very carefully calibrated. We continue to improve on those systems that we have been building in the last 2 years. But we need to take a very careful risk-based approach, whether we need to be locking down, whether we need to be preventing travel, how much of restrictions we put on people, because if the disease like that caused by Omicron is not driving a lot of hospital admissions and the healthcare systems are holding up, then we should try to keep help people live with this variant and help keep the economy moving rather than locking down and closing down, because we have been emphasizing that it's health and economy, it's not health versus economy. We need to try to see how we can protect both sectors and keep the momentum, because a lot of people are affected by economic restrictions and travel bans, and it just gives you a false sense of confidence. So we have to be careful in those measures, look and assess whether it's absolutely necessary, and take a very risk-based approach in implementing those measures.
Dr. Rabi,
Thank
we
you.
have questions from our friends from the media. Question from Jason Rubrico of SMNI News. Dr. Rabi, is there any standard self-medication set by the WHO for individuals who don't want to go to the hospital? What can a person do to treat himself without going to the hospital for fear of getting infected with COVID-19? Is drinking water and vitamins or eating fruits enough to fight the virus?
Well, most people who are testing positive for Omicron variant are mildly symptomatic or asymptomatic. So if you have fever, you could take some antipyretic like paracetamol. Uh, Beyond that, there is no specific treatment that is required or may be required by more than 90% of the people who test positive. It's only those vulnerable people, the elderly and comorbid people, especially those people who have not yet accessed vaccines, who are at risk. So our message is, while we are managing this surge, especially in NCR and the adjoining regions, is to try to improve vaccine coverage given the large stock of vaccines in the country among the elderly, among the comorbid population across the country, and also to afford boosters to the healthcare workers and other at-risk populations, so that we keep the healthcare system functional and we protect the most vulnerable groups from getting severe disease. Um, there is no particular added advantage in taking other medications. Of course, keeping hydrated is important. Eating healthy, fresh food is important, but uh, those are not absolutely effective against Omicron. COVID-19 largely caused by Omicron is a mild disease. So there's no specific treatment that is particularly required unless you are at risk or you have comorbidities or you're from the vulnerable age group.
Dr. Rabi, a question from Red Mendoza of Manila Times. The Philippines is experiencing a surge of cases which is caused by the increased mobility during the holiday season and the potential prevalence of the Omicron variant. Did you see this as a potential failure of the Filipino public to follow the minimum health standards during the holiday season, which could have greatly influenced the surge of cases?
Well, we reiterated before the advent of the holiday season the need to follow the minimum public health standards. But unfortunately, we saw that with the very low number of cases that we were reporting in early December, that there was sort of a release from the part of the people that there was now an opportunity to be free of this virus, but that was a false sense of security, and that's why we continue to reiterate that even when you are celebrating the Christmas season, you need to follow the minimum public health standards. You need to ensure that you access the vaccines as early as possible. And of course, because those precautions were not followed in some areas, we are now seeing the results of that. So the message here is clear. We know what needs to be done. We need to do it all. and we need to continue to do it till this pandemic is no longer an issue.
Question still from Red Mendoza of Manila Times, Dr. Rabi. Will the WHO set a recommendation on possibly shortening the isolation and quarantine periods due to new research and due to the fact that there is a danger of potentially losing critical workforce, especially among the healthcare sector due to the high transmissibility of the Omicron variant?
Well, we are conscious of this. We are looking at global experiences. Many countries have reduced the quarantine and isolation period, and we are also looking at the global evidence. We would quite likely be making some recommendations on those counts, based, of course, on vaccination status, based on the predominance of this or the other variant. And so we expect that we will be sharing with governments some recommendations on taking a risk-based approach to reduce the quarantine and isolation durations so that we can provide uninterrupted services to people, especially in the healthcare, recognizing that it's not only COVID-19 that healthcare workers are providing services for. Thank you.
Opo. Dr. Rabi, this question is from Vivian Gulia of ABS-CBN. The WHO warned that simply repeating booster doses of the original COVID vaccines is not a viable strategy. What are its risks?
So we have always reiterated that primary vaccination for everybody at risk is more important than providing boosters to people who have already completed the primary course of vaccinations. And we continue to emphasize that because we continue to see that there are a large number of people in the Philippines who have still not been able to access their primary vaccines for whatever reasons. So our plea again to the population is to access those vaccines. Our plea to the local government units and the respective health units is to ensure that everybody can access the vaccines and are able to access those vaccines and are protected. But given the abundance of vaccines in the Philippines, and I'm happy to note that WHO and COVAX committed to provide 44 million doses to the Philippines in 2021. We actually provided more than 62 million doses. So not enough vaccines to fully protect 20% of the population. We actually provided enough vaccines to protect 37 million Filipinos last year. So our plea to you is make use of those vaccines and make use of the availability of the vaccines to protect yourself from severe disease and death by accessing the vaccines primarily as the primary course, but also for those who have been vaccinated with the primary course with boosters.
Another question from Vivian Gulia. Dr. Rabi, while existing vaccines protect against COVID, it does not completely block transmission as seen with the Omicron variant. What is the recommended vaccination strategy to combat COVID moving forward?
The fact of the matter, Yusek Raki, is that none of the vaccines currently available can protect infection happening. We can only protect severe disease and protect people from developing severe disease and death. At this point of time, it's a high priority for the global community to develop a vaccine that can prevent COVID-19 infection. Till we have that, we have to depend on these vaccines to protect people from severe disease and death. And that will allow us to continue with economic activity, to continue an economic rebound and manage our daily lives. So until we have such vaccines that can protect people from acquiring infection, this is what we have at the moment. We need to maximize the use of them.
Question from MJ Blanca Flor of Daily Tribune. This week, the national government is expected to decide whether Metro Manila will be placed under stricter alert level or not on January 16 to 31st. For WHO, should authorities implement stricter restrictions in the capital region to stem virus spread?
Well, we are looking closely at the current alert level 3, and as I mentioned earlier, we are seeing a significant reduction in mobility. And if yesterday's reduction in numbers is an indication, maybe the current alert levels are adequate. We are very conscious that we will need to increase those alert levels and increase the restrictions only if we see signs of the healthcare system being overwhelmed. Right now, we don't see that. Our projections are that the Philippines may be able to avert that even if current trends are continued till about the end of this month, meaning that red line analysis that we have done projects that we can manage the health systems till about the 27th, 28th of January, given the trends up to yesterday. With yesterday's decline, we may be even to manage beyond that. So we are very careful in saying we need to restrict movements more. What is important is at an individual level, everybody following with the minimum public health standards and isolating or quarantining themselves if they have symptoms or exposure, so that we reduce the risk of transmission and reduce the need for stricter quarantine, because that has very serious economic consequences. We need to try to take that risk-based approach and try to keep the economy open unless we are seeing signs that the current levels of alert levels are not working.
Dr. Rabi, question from Maricel Halili of TV5. Professor Jimenez of the University of Colorado said that the Philippines should let go of face shields and plexiglass barriers because these are useless and waste of money. He said health workers should wear laboratory goggles because COVID is clearly airborne. Will you recommend this the same thing, especially for healthcare workers?
For healthcare workers, if they have goggles, it's good to wear goggles. If they don't have, it's better for them to use face shields in the absence of goggles. But we are talking of healthcare workers who are involved in aerosol generating procedures. It's not necessary for every healthcare worker to wear goggles. It's not necessary for every healthcare worker to wear face shields. If they're masking well with a tight-fitting mask, that would be enough protection. And beyond that, it's about the hand hygiene, the physical distancing. For normal healthcare workers who are not involved in aerosol generating procedures in caring for COVID-19 patients. And of course, the triaging needs to happen so that we reduce the risk to healthcare workers who are not caring for COVID-19 patients so that they can continue to function in facilities.
Dr. Rabi, question from Leigh Alvis of GMA News. What is your assessment of the current COVID situation in the country, where a number of cases are vaccinated and some even received their booster shots?
So we've seen clearly global evidence, and that's why I reiterated earlier also, the vaccines are not capable of preventing infection. So people who have been fully vaccinated, people who have received a booster shot, continue to get infected, but those infections are mild because the currently available vaccines are not capable of preventing infection. So that's not entirely surprising. We've known this right along. What we know is that the vaccines can prevent severe disease and death. And that is why we are advocating that people continue to access those currently available vaccines so that we prevent further severe disease, overburdening of the health system, and reduce the number of deaths happening.
Dr. Rabi, thank you so much for joining us today. Dr. Rabi Abengasihe from the World Health Organization. Always keep safe, Dr. Rabi.
Ng ibang mga frontliners natin dito lang po sa central office, out of our 1,104 total employees, meron po kaming 57 na mga nagpositibo. Around 5% of our employees from the central office ay nagka-COVID. Ngunit karamihan po sa kanila ay mild and asymptomatic at marami na po ang gumaling. Meron din po kaming mga nag-positive sa mga regions, no? Pero hindi naman po ganun kadamihan.
Opo. Pero Yusek, sa ngayon, ilan daw po yung nadagdag sa mga nag-granular lockdown sa bansa, ilan sa Metro Manila at ilan sa iba pang regions? Yan din po ang tanong ni Sheena Torno ng SMNI kung meron daw pong datos.
Opo, meron po tayong datos. Dito po sa NCR, meron po tayong 97 na ongoing granular lockdowns. Yan pong 97 na yan ay merong 102 na apektadong pamilya, which is equivalent to 463 individuals. Kung titingnan naman po natin ang kabuang numero sa buong bansa, meron po tayong 107 lockdowns in the entire country for a total of 679 individuals under granular lockdown.
Opo. Pero Yusek, mahigpit naman po ba daw na nababantayan ng mga pulis at ng iba pang force multipliers sa mga naka-granular lockdown? At simula na rin po ba yung pagbabantay nila sa mga quarantine hotels?
Opo, matagal na po nating na-implement itong alert level system, kaya sanay na po ang ating kapulisan kasama ang ating mga barangay tanod at local government officials sa pagbabantay sa granular lockdown. At nakikita naman po natin yan madalas na i-report sa media, yung patuloy na pagbabantay natin dun sa mga lugar na naka-granular lockdown. Tukol naman po doon sa mga hotels, quarantine hotels na siyang binabantayan ng Philippine National Police alinsunod sa naging kautusan ng Pangulo na magtalaga ng 2 police officers sa bawat quarantine facility. Meron po tayong 270 na DOH, BOQ or Department of Tourism hotel na ngayon ay merong mga naka-check-in na returning Filipinos. Ang ginawa po ng ating kapulisan ay naglagay ng help desk sa 247 na facility quarantine na ito at nakapag-deploy po tayo ng 748 police officers na ngayon ay nagbabantay 24 hours sa mga quarantine facilities na aking binanggit. Sa kabuuan po, 18,562 na mga quarantine individuals ang ngayon ay sinisecure ng ating mga kapulisan, which total 748.
Opo. Paano naman daw po ini-intensify ng DILG ito namang contact tracing sa ngayon at ang effect ng home isolation? Marami rin daw po kasing BERT workers, ang BERT, ang workers ang nagpo-positibo ngayon.
Opo, unang-una po, meron po tayong sinasagawang reorientation ng ating mga BHERTs at ng ating mga barangay health workers. Kasama po ito sa naging direktiba ng Department of Health na itong panahon na may surge ay kailangan magkaroon tayo ng reorientation para mapaalala sa ating mga barangay health workers and barangay health emergency response teams yung kanilang katungkulan sa panahon ng pandemya. Patuloy naman po ang contact tracing ng ating mga local government units sa pangunguna ng City Epidemiological Surveillance Unit para agaran pong makontact trace ang mga positibo, naging close contacts ng mga positibo. Ngunit mahirap po talaga ngayon, mas mahirap po kasi so yan binabantayan.
Opo. So, Yusek, medyo naputol kayo sa bandang huli dahil mahirap po ngayon dahil pakiulit lang po yung huling yung sinabi, Yusek.
Opo, mas mahirap po kasi mag-contact trace pag may surge. Kasi 'di ba, ang pagtaas ng ating mga kaso ay exponent, no? Mabilis ang pagtaas. So pag mapadami po ang kino-contact trace, napakahirap din po ng ginagawang contact tracing. But nonetheless, nakatutok po ang lahat ng contact tracers natin para para ma-trace natin at ma-detect natin kung saan nanggaling at para ma-test and ma-isolate yung mga close contacts ng ating mga COVID positives.
Opo. Yusek, kayo na rin po kasi rin ang nagsabi na may vaccine hesitancy pa rin among provincial barangay officials. Ano po? May hakbang po bang gagawin ng DILG tungkol dito para mahikayat kasama na rin po yung constituents nila na magpabakuna?
Opo, mula po na nagsimula ang ating intensified vaccination program, especially noong nagsagawa tayo ng National Vaccination Day, tuloy-tuloy po ang ating programa to encourage people to get vaccinated. Kasama na rin po, of course, yung mga naiiwan pang mga barangay officials na hanggang ngayon ay hindi napagmuna. Meron po tayong localized information dissemination program. Gumagamit po tayo ng local influencers gaya ng kanilang mga local officials gaya ng mayor, yung at kanilang vice mayor at mga iba pa. Meron po tayong isinasagawang mga town hall meetings na kung saan may mga eksperto po tayong iniimbitahan gaya ng mga doktor mula sa Philippine Medical Association at yung allied medical professions. At gumagawa rin po tayo ng mga outreach activities at ginagawa po natin itong mga outreach activities na ito sa mga komunidad para po makarating sa kanila yung ating mensahe na kailangan ng magpabakuna. Kailangan po kasi na sa aming pong eksperyensya, kailangan po nating puntahan sa mga barangay yung mga hindi pa nagpapabakuna because that's the only way we can get our message across.
Opo. Yusek, paano naman kaya daw napapatupad yun daw pong direktiba ng Pangulo na limited mobility sa mga unvaccinated kung mismong local executives daw po ay hindi nagpapabakuna?
Okay. Unang-una po Yusek Rocky, hindi na po karamihan yung mga barangay officials na hindi pa nagpapabakuna. Konti na lang po yan. Para po masiguro natin yung datos natin ng mga unvaccinated, nagpalabas po si Secretary Anyo ng Memorandum Circular para magsagawa ng inventaryo ang lahat ng mga barangay sa buong bansa para malaman yung mga hindi pa nagpapabakuna sa mga barangay in line with the pronouncement of the President na i-restrain or i-restrict yung movement ng ating mga unvaccinated individuals. So, Yusek Rocky, it all begins with an inventory. And then, pag meron na po tayong inventaryo, doon na po i-implement ng LGU through a ordinance yung mga restrictions sa movement ng mga unvaccinated individuals. At dito po sa Metro Manila, 3 LGU na lamang ang hindi pa nagpapasa ng kanilang ordinansa restricting the unvaccinated individuals, no, the mobility of unvaccinated individuals. So I would expect Yusek in the next few days ay all 17 LGUs in Metro Manila will have their own enforcing the President's directive. And hindi rin po ako mabibigla kung sa mga probinsya ay magpapasa na rin sila ng mga similar ordinances dahil nagpasa na rin po ang League of Provinces of the Philippines sa pangunguna ni Governor Presbiterio Velasco ng resolution kung saan they are also encouraging yung kanilang mga miyembro mga member provinces na magpasa ng ganitong ordinansa. So pag meron na pong mga ordinansa, this will now serve as the guidelines of the barangays and of the PNP sa implementasyon ng direktiba ng ating Pangulo to restrict the mobility of the unvaccinated.
Opo, Yusek, pwede po bang malaman kung ano daw po yung 3 LGU na hindi pa nagpapasa ng ordinansa o nagpapatupad?
Well, kasi po sa aming report ng DILG-NCR, meron ng nakasalang na mga ordinansa sa konseho ng Navotas, Makati, and Pasig, ngunit hindi pa po ito naaaprubahan. In other words, it's under deliberation by the City Council. And we expect that in the next few days ay mapapasa na po ito dahil unanimous naman po yung naging desisyon ng lahat ng mayors ng Metro Manila na isusulong nila ang mobility restrictions against unvaccinated in consonance with the directive of the President.
Panghuli na lang po, Yusek, ano daw po ang reaksyon ninyo sa muling pagpapatupad ng curfew hours dito sa Metro Manila para sa menor de edad? Sa palagay ninyo, dapat din po ba itong ipatupad sa edad 18 pataas?
We fully support. We fully support po yung naging desisyon ng Metro Manila Council as announced by the chairman, Mayor Olivares, na magkaroon ng curfew para sa mga minor de edad. No? Tamang-tama lang po yan dahil kailangan natin ng ganong klaseng mobility restrictions sa mga minors dahil nga po sa pagtaas ng insidente ng COVID-19 sa National Capital Region. Siguro po kung malalala pa ang sitwasyon at tumaas yung ating healthcare utilization sa high levels, no? Siguro panahon na para mapag-aralan din ng ating mga LGUs yung curfew, not only minors but for adults.
Opo. Yusek, kunin ko na lamang yung mensahe o paalala ninyo sa ating mga kababayan.
Opo, nananawagan lang po kami sa kababayan na magdala lagi ng vaccination card kung kayo po ay babiyahe o papasok sa mga pampublikong lugar. Dahil meron na po naipasang ordinansa at meron pong kautusan ng ating Pangulo na kailangan ipakita ang vaccination card sa mga checkpoints o kaya naman sa mga restaurants or malls. Ngayon, nakikiusap din po kami sa mga business establishments na tumulong magpatupad nito. Kasi wala naman po tayong pulis na pwedeng i-assign sa bawat restaurant na ang trabaho lamang ay i-inspect ang vaccination card ng mga parokyano. So, it is the responsibility also of the business establishment to ensure that all of his employees are vaccinated and all of his customers are vaccinated as well. Sana po tulungan tayo ang pamahalaan at ang ating mga kababayan.
Okay, maraming salamat po, DILG Spokesperson Undersecretary Jonathan Malaya.
Magandang tanghali po sa ating mga kababayan at sa Malacanang Press Corps. Una po sa lahat, papasalamat po kami sa cooperative.
RPN, Radio Philippines Network Incorporated.